Hey all, welcome to ShareTrekc. This is Raj here. Friends, today I want to talk to you about Caribou Biosciences. They had a really good development that happened last week, but I couldn't talk about it because I had to read a little bit more before producing a video. And I have done my homework now. And I would like to talk to you about Caribou. Last week, they announced that they received clearance for their IND or investigational new drug application from the FDA for CB-012, which is an allogenic therapy. It's a cell therapy for a type of cancer. And CB-012 will be evaluated in their multi-center open label phase 1 clinical trial that they have labeled as Amplify, AM capital, P small, L capital, IFY. It's a stylistic way of naming the clinical trials. And it's going to be targeting people with refractory acute myeloid leukemia or R/R-AML. And this is the third allogenic CAR T cell therapy from Caribou Biosciences to enter into clinical trials. And patient enrollment for the phase 1 trial will begin by the middle of next year, that is 2024. And it will include patients suffering from AML. It should be noted that Caribou's patented next-gen CRISPR-Cas12a chRDNA genome editing technology platform maintains high genomic integrity and significantly improves the specificity of genome editing. Caribou also calls this as the Chardonnay. And I think this particular technology is also going to give a lot of revenue for Caribou Biosciences, as other companies might license it for producing their own therapies. So let's now dig down into understanding AML. And then we'll talk about how CB-012 works. And we'll discuss the edits involved in CB-012. Let's get started. Welcome back, friends. AML, or acute myeloid leukemia, is a type of cancer that affects the bone marrow and blood. It's characterized by the rapid and uncontrolled growth of abnormal white blood cells, which is the myeloid cells, in the bone marrow, which normally produce healthy blood cells, but AML is a serious and aggressive form of leukemia. Here are some key points to help you understand AML. Bone marrow and blood is the place where AML primarily affects. AML primarily affects the bone marrow, where blood cells are produced in a healthy person. The bone marrow produces red blood cells, white blood cells, and platelets. In AML, when a person is suffering from AML, the production of normal blood cells is disrupted by the proliferation of immature and dysfunctional white blood cells. That is the root cause of the disease called AML. And when we talk about abnormal cells, they also have abnormal cell growth. AML is characterized by the rapid growth of abnormal myeloid cells, often referred to as blast cells. These cells do not mature into functional white blood cells, and they can overcrowd the bone marrow, interfering with the production of normal blood cells. And if we were to look at the symptoms of this condition, the common symptoms of AML can include fatigue, weakness, frequent infections, easy bruising, bleeding, fever, and bone pain. These symptoms often result from the suppression of normal blood cell production and the buildup of abnormal cells. When we talk about diagnostics, AML is typically diagnosed through a combination of blood tests, bone marrow biopsy, and genetic testing. Genetic testing is crucial because it can help determine the specific subtype of AML and hence guide treatment decisions. And I would like to talk to you about the current standard of care and prognosis, which is what I do always when comparing it to a once and done cure like the ones that genetic therapy offers. So let us look at treatment. Treatment for AML currently is aggressive and may include chemotherapy, which is the primary treatment for AML at present. It aims to destroy the cancerous cells and allow the bone marrow to produce normal blood cells again. And then we have bone marrow transplant. For some patients, a bone marrow or stem cell transplant may be recommended. This involves replacing the patient's bone marrow with healthy donor cells. And then we have targeted therapies. Some newer treatments target specific genetic mutations found in AML cells, offering more personalized and effective therapy. And that's the category of CB-012. And we also have at present supportive care, which is AML treatment often weakens the immune system and causes side effects. So supportive care is needed, which includes blood transfusions and antibiotics to help manage these issues. And in terms of prognosis, the current standard of care shows that for AML, prognosis can vary on factors such as the patient's age, overall health, and genetic subtype of the disease. AML can be curable for some patients, especially those who are younger and in good health. However, it can be more challenging to treat for older individuals and who are having a weaker constitution. And now let us talk about how CB-012 works. CB-012 is a novel allogenic gene therapy that has been engineered with 5 specific genome edits. These edits are designed to enhance its effectiveness as a CAR T cell therapy, particularly in targeting difficult to treat cancers. Let's break down each of the genomic edits to understand how CB-012 works. The first edit they have is the PD-1 knockout. PD-1 or programmed cell death protein 1. We have spoken about this before. PD-1 is a checkpoint protein that can limit the activity of immune cells, including CAR T cells, when it interacts with its ligand PD-L1 on cancer cells. The PD-1 knockout in CB-012 involves disrupting the PD-1 gene, preventing the expression of PD-1 on the surface of CAR T cells. By doing this, CB-012 essentially removes a molecular brake that might otherwise inhibit the immune response to cancer. This edit enhances the CAR T cell's ability to recognize and attack cancer cells more effectively. And I'm saying it is more effective because it has got a chimeric antigen receptor, which is going to target a particular antigen that will be found on this particular type of cancer cells. Without the chimeric antigen receptor, this kind of modification can create a havoc in the body, because then the CAR T cells can attack other parts of the body as well. Now let us dig a little bit deep into PD-1 and PD-L1. PD-1, that is the programmed cell death protein 1, interacts with PD-L1 which is expressed on the surface of certain immune cells, such as T cells. When PD-1 on a T cell binds to PD-L1 on a target cell, like a cancer cell or infected cell, it sends an inhibitory signals to the T cell, thereby preventing the T cell from releasing cytokines or summoning other immune cells to attack and kill the cancer cell. This interaction acts as an immune checkpoint. In a healthy immune system, it serves to prevent excessive immune response that could damage normal tissues. It essentially helps to maintain immune tolerance and prevent autoimmune diseases. However, some cancer cells and infected cells can exploit the PD-L1/PD-1 interaction to evade the human immune system. When PD-L1 on these cells binds to PD-1 on T cells, it inhibits the T cells' activity, preventing them from attacking the cancer or infected cells effectively. This allows these rogue cells to escape immune surveillance and destruction and continue to grow. PD-1 knockout in CB-012 builds a defense against this strategy of cancer cells. B2M knockout is the second edit. B2M or beta-2 microglobin is a protein required for the normal functioning of HLA class 1 molecules, which present antigens to immune cells. By knocking out B2M in CB-012, the therapy disrupts the expression of HLA class 1 molecules on its surface. This edit is a form of immune cloaking. Without HLA class 1 molecules, the CAR T cells can evade recognition by the host's immune system. This is beneficial because it reduces the chance of host's immune system attacking and eliminating the edited CAR T cells before they can target the cancer cells. This edit allows CB-012 to persist longer in the body and evade human immune defenses that may try to detect and kill it. Then we have the B2M HLA E fusion transgene insertion. In contrast to knocking out B2M, CB-012 also includes the insertion of a modified HLA-E molecule. HLA-E molecule is a non-classical MHC class 1 molecule. By engineering a fusion transgene that combines B2M and HLA-E, CB-012 creates a unique molecule on its surface. This modified HLA-E molecule can engage with the inhibitory NKG2A receptor on natural killer cells, another type of immune cells. This interaction sends a signal to the signal that suppresses the activity of NK cells. In this way, CB-012 can protect itself from attack by natural killer cells, further enhancing its survival and effectiveness. And friends, this is a very, very important edit, because whenever we tamper with MHC1 cell or we modify it, NK cells immediately gravitate to those cells because they feel that if a cell doesn't have MHC1 or it has got a modification of MHC1, then it must have been infected. And that's the reason why NK cells gravitate to them and destroy them. By providing HLA-E to engage with NKG receptor, NKG-A receptor, the persistence of the CB-012 engineered cells in the body is prolonged and immunized from natural killer cell trying to kill it. So in summary, CB-012 is a cutting-edge allogenic CAR T cell therapy that combines several genetic modifications to improve its anti-tumor activity. It achieves this through disrupting the PD-1 checkpoint to enhance CAR T cell activity, knocking out B2M to evade host immune recognition, and then inserting a B2M-HLA-E fusion transgene in order to engage the inhibitory NKG2A receptor on NK cells, preventing their attack on the CAR T cells and help prolong the persistence of the modified CAR T cell, which is the CB-012. These genetic edits collectively create a powerful immunotherapy approach designed to improve the efficacy of CAR T cell treatment for challenging cancers, making it more effective and resistant to host immune system attacks. Friends, Caribou may be a bit late to the party, but I think when they monetize, they will be doing great. Also, their Chardonnay technology is likely to find good uptake as an upgrade over traditional CRISPR-Cas9. And let me also posit that when Caribou Biosciences perfects this whole system of cloaking the modified CAR T cell from the immune system, then all they have to do for subsequent cancer therapies is to modify the chimeric antigen receptor to target a different antigen, and they would have a suite of cancer treatments, suite of CAR T therapies available at very, very rapid rate because most of the components of the CAR T modifications would be tested except for the antigen when it comes to new CAR T therapies for Caribou. So I think this is going to put Caribou in a very, very cost-effective position when it comes to creating future therapies. Well, friends, then I took a look at the price chart for Caribou Biosciences, and I see that the share price dropped from 18th of October onwards when we had news that AbbVie announced that it is dropping its collaboration with Caribou, making a loss of potential revenue to the tune of $350 million. I had made a video at that point of time, and at that time also I emphasized that AbbVie's termination of the deal with Caribou does not reflect negatively on the Chardonnay platform or Chardonnay technology or the Chardonnay tool. I hold that opinion even now. So I think AbbVie just did a bunch of investment and then they decided to change their strategy and they have moved away from CAR T. So that's their lookout, but I don't think it affects Caribou. However, the stock market doesn't seem to think so. It has punished Caribou significantly. Overall, I would like to say that like most genomic companies other than CRISPR Therapeutics and Bluebird, an investor has to be patient and consider these as long-term investments with a well-defined portfolio that matches their risk appetite. So I would say that Caribou Biosciences, in my mind, is still a fantastic company. It has got a great CEO. And they are a no-drama company, just like CRISPR. They have put their heads down and they are working. It may seem that they are going slow, but the strength of their strategy is absolutely phenomenal. And I think they can replicate CB-012 with a modification of their chimeric antigen to target other cancers. So I would definitely watch Caribou Biosciences and hope to pick some shares as the share price goes down. I do not know when it will start turning around, but I do expect that when Hexacell and Lovocell get their approval somewhere in December, we are going to see a positive outlook for many genomics shares because the markets will sit and take notice, at least for a short period of time. And we should see some positive growth at that time for Caribou Biosciences. Over and above that, I think it's going to be a potential genomic blue chips. So that's all for now, my friends, and I'll be back soon with the next video. And I hope that you liked this video, and I look forward to hear your comments. Do you have Caribou in your portfolio, and do you agree with my assessment, or do you have a different viewpoint? Please share that in the comment section so that not only myself, but also our community can benefit. With that, I'd like to end this video here. Bye for now.